Unit 5. Medical Practitioners 1. A. Practitioners. In Britain, doctors, also known as medical practitioners, must be qualified, have a university degree in medicine. They must also be registered, included in the General Medical Council list, or registered in order to practice. See Unit 13. A doctor who treats patients as opposed to one who only does research is called a clinician. A doctor who provides primary care for patients is known as general practitioner, GP, or family doctor. GPs actually work in a group practice. Large group practice work in a building called a health center. Note: in British English, the verb is spelled practice with S, and the noun is spelled practice with C. B. Specialties. Specialist doctors, for example, pediatricians, generally work in hospitals. However, those who work outside the NHS, providing private health care, may have consulting rooms outside the hospital. For example, in a famous Harley Street in London. The two main branches of medicine are surgery and internal medicine, and the doctors who practice these branches are called surgeons and physicians, respectively. In Britain, male surgeons are addressed as Mr. and females as Miss. So Dr. Smith is a physician and Mrs. Smith is a surgeon. A cardiologist, a cardiologist specializes in diseases of the heart and circulation of cardiology. A geriatrician is a specialist in diseases of elderly patients or geriatrics. An anesthetist is a specialist in anesthetics. Note: names of specialties usually end in ology. Names of specialists usually end in ologist. If the name of a specialty ends in "ix", the name of the specialist ends in "ician". There are some exceptions, for example, anesthetics and anesthetist. C. Choosing a specialty. Jill Matthews has just graduated from medical school and is talking about her future. I haven't decided what to specialize in yet. I need more experience before I decide, but I'm quite attracted to the idea of pediatrics because I like working with children. I certainly prefer to work with children than, say, elderly patients. So I don't fancy geriatrics. I was never very interested in detailed anatomy, so the surgical specialties like neurosurgery don't really appeal. You have the you have to be good with your hands, which I don't think is a problem for me. I've assisted at operations several times, and I've haven't done some minor ops by myself. But surgeons have to be able to do the same thing again and again without getting bored, like tying off good arteries and so on. I don't think that will be a problem for me, but they need to make the decisions fast, and I'm not too good at that. I like to have time to think, which means surgeries probably are not right for me. Note: the collocation "good with" is followed by a noun. He is good with children. The collocation "good at" is followed by the in ing form, gerund, of a verb or by a noun. She is good at explaining producers. She is good at explanations. Unit 6. Medical Practitioners 2. Hospital Staff. The people who work in any type of workspace, including hospitals, are called the staff. The medical staff in a British hospital belong to one of four main groups. A pre-registration house officer (PRHO) or house officer is a newly graduate doctor in the first year of postgraduate training. After a year, he or she becomes a registered medical practitioner in the current system of training, the Foundation Program. Name for these junior doctors is Foundation Year 1 Doctor, FJ1. See Unit 12. A senior a senior house officer SHO in the second year of postgraduate training. The title is Known Foundation Year 2, the FY2, but the old terms Senior House Officer and SHO are still used. A specialist registered SPR is a doctor who has completed the foundation program and is training in one of the medical specialties. There are also some non-training registered doctors who have completed their training but don't wish to specialize yet. A consultant is a fully qualified specialist. There may also be some associated specialists, senior doctors who don't wish to become consultants. In addition, there is at least one medical or clinical director who is responsible for all the medical staff. Medical teams. Consultant physicians and surgeons are responsible for a specific number of patients in the hospital. Each consultant has a team and senior doctor who to help care for those patients. In many hospitals, in many hospitals, there are multidisciplinary teams which consist in not only of doctors but also of physiotherapists and other allied health professionals. See Unit 8. When patients enter or are admitted to hospital, they are usually seen first by one of the junior seniors, and the ward are they will receive treatment and care. The senior doctors then takes their medical history and them, examines them. Sometime later, the registrar also sees the patients and may order investigation or test, for example, X-rays or an ECG, make a provisional diagnosis and make treatment. The consultant usually sees the new admissions, people who have recently been admitted to the ward for the first time on the one of the regular ward rounds. When the management of the patients is discussed with the registrar, consultants also decide when a patient is ready to be discharged, sent to home. On the ward round, the consultant is accompanied by the team and nurse, and they visit the patients in the consultant's care. C. Shifts. Junior doctors now actually now normally work in shifts, which means they normally work for 8 hours every day, for example, 7 a.m. to 3 p.m., and are then free until 7 a.m. the next day. After a week, they change to a different shift, for example, 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative system is to work from 9 a.m. to 5 p.m. every day and to take turns to be on call. Available to return into the hospital if it's necessary from 5 p.m. to 9 a.m. the next day. Days on call Days on call are set out in a rota or list of names on times. Doctors on call carry a cardio pager or bleeper device which makes a noise when someone is trying to contact them. Unit 7. Nurses. A. Nursing grades. Nurses working in a hospital have the following grades: a student nurse, a nurse who is still in training; a staff nurse, a nurse who has completed the training course; nurse charge nurse, a more experienced nurse who is in charge of or responsible for a ward or department; nurse manager, a nurse who is in charge of several wards. Note: the old term sister is still something used for a female charge nurse. A female nurse manager may be called matron. Dr. James is talking to Sister Watkins. B. Support workers. The clinical support worker who has done a short course and obtained basic qualifications, and the nursing auxiliary who is usually unqualified. Both assist nursing and information are up to date and answering to the telephone. Specialization. Like doctors, nurse can specialize. A midwife has specialized from the beginning by doing a course in midwifery, the management of pregnancy and children. District nurse visit patients in their homes. Health visitors also work in the community giving advice and promotion of health in prevention illnesses. D. The nurse's role. The nurse role has changed considerably in recent years. In addition to general patient care, checking temperatures, pulse rates, and blood pressures, changing, changing designs, dressings, giving injections, and removing stores. Nurse now Nurse now do some of the things previously reserved from doctors, such as prescribing drugs and ordering laboratory tests. More responsibility for nurses is plain as the following article demonstrates. Nurse carry out surgery in effort to cut patient waiting list. Nurses in Scotland trained to perform minor surgery have entered the operating theater for the first time in an effort to cut patient waiting times. Five nurses who have tasted a new course of Glasgow Caledonian University are now qualified to carry out such procedures as the removal of small lesions beneath molds and sites. The verbs perform and carry out are used with all types of predecessors. They are often used in the passive form. Perform, carry out, an examination, an operation, a procedure, an experiment, a test, a biopsy. The procedure was performed or carried out by a nurse. Unit 8. Allied health professionals. A community health. The health of the community depends on a large number of people other than medical practitioners and nurses. These can be grouped under the heading of allied health professionals. They are included the following: physiotherapists or physios, help people to move by getting them to do exercises or by treating their body with heat or massage. Treatment by manipulating muscles and joints with the hands. See Unit 42. Occupational therapists, OTS, help people with a disability to perform tasks at home and at work. A disability is a physical or mental condition that makes it difficult to live normally. For example, blindness or deafness. Social workers help people to solve their social problems. For example, poor housing or unemployment or family problems. Chiropractic, or also known podiatricians, treat conditions affecting the feet. Technicians. There are numerous technicians, people who work with scientific equipment, such as radiographers, who are known as X-ray technicians, Ambulance technicians work in the emergency medicine service. An ambulance technician with more advanced qualification is called a paramedic. Prosthetics and orthotists. Prosthetists and orthotists provide care for anyone who needs an artificial limb, a prosthesis, a prosthesis, or a device to support or control part of the body, and orthosis. They also advise in a rehabilitation, helping patients return to normal life and work after treatment. Prosthetists provide artificial replacement for patients who have had an amputation or were born without a limb. Orthoses provide a range of splints and other devices to aid movement, correct deformity from an abdominal development or part of the body. For example, clubfoot, talipes, and relief pain. Opticians. Opticians test eyesight and provide glasses, also known as spectacles and contact lenses, when it's necessary. The examination includes measuring intraocular pressure, that the pressure of fluid inside of the eye, then the examining the retina. If the optician suspect an eye disease such as glaucoma, they refer the patient to their GP for treatment. The GP may then refer the patient and an ophthalmologist, a doctor who specializes in disease of the eye. Unit 9. Hospitals. A. Introduction to a hospital. Jordi Pons is a fourth-year medical student from Barcelona. He has come to Britain on elective attachment on the Royal Infirmary, Edinburgh. Dr. Barron is introducing him to the hospital. Dr. Barron. The Royal Infirmary is the name of the University Hospital for Edinburgh University. It is a general hospital dealing with all types of patients and illnesses, except pediatrics. We have a specialist hospital for that in another part of Edinburgh, the Hospital for Sick Children. You can see some of the departments in our hospital on site. Of course, there are many others. For example, the intensive care unit is ICU and the surgical high dependency unit, HDU. Here it says, what does outpatient mean? Dr. Barron. Dr. Barron says, all patients are the people who come to the hospital and attend at a clinic or to have tests or treatment and then return home on the same day. Inpatients stay in the hospital for one or more days. The rooms where they stay are called wards. If a patient treatment requires only one day, such as simple operation, they can be admitted to the day surgery unit. Outpatients. Dr. Byron says, the accident or an emergency department, A&E, also called consulti, is where patients who are acutely ill with a sudden serious condition come for assessment and treatment. Our patients who have an appointment to see a specialist go to a clinic in one of the outpatient department, OPDs. They have usually been referred to the hospital by their GP, who writes a referral letter to consultant explaining the patient's problem. C. Inpatients. Dr. Barron says, the inpatients in a hospital are admitted in one of the main ways. They may be seen in one of the outpatient clinics and admitted there, or if there is a lot of demand for the treatment they need, as in the case of a hip replacement, they are put on the waiting list for admission. Alternatively, their GP may arrange the admission by telephone because they are acutely ill, for example, with suspect myocardial infarction, or they are seen in the A&E department, where the doctor on duty working at the time arrange the admission. This will happen in the case of a patient who with a fractured neck of femur, for example. Larger hospital may have an assessment unit where patients can be admitted temporarily while their condition is assessed. Jordi asks, assessed? Yes. Decisions are made about their condition and what needs to be done to help them. After treatment is completed, the patient is discharged back to the GP's care.